And a special report from the LA Times says Blue Shield of California initially sought an expansive amount of medical data from the University of California health system in exchange for doses of the COVID vaccine. Well, both UC and patient privacy advocates have sounded the alarm over this. The contract has since been revised, quote, to limit access just to vaccination records and only by federal and state agencies and their contractors. Earlier today, I spoke with Melody Gutierrez, a reporter with the Times, who broke the story. Melody, thanks so much for being with us. We certainly appreciate your time. This is a really interesting story just because I think of the privacy, the patient privacy concerns that are at stake here. Just explain in layman's terms the relationship between Blue Shield and California's health department.
Right. So Blue Shield has come in as the independent overseer of California's vaccine program. This is in result to the state having a very slow rollout initially. January was very hard for the state for trying to ramp up its efforts to get vaccine distributed across the state. And what we kept realizing is that the number of vaccines coming into the state and the number of vaccines administered, there was a large gap there. So there was a belief that there were a lot of vaccines that were just sitting on shelves. So in February, Governor Newsom announced that they were going to partner with Blue Shield, have Blue Shield come in and help with the data aspects, with the analytics of helping determine where vaccine needed to go. And it was all in an effort to ensure that the state can quickly get vaccine into people's arms.
Makes sense. They needed some help. California, big state that certainly a couple of weeks ago was the epicenter of the crisis. High death toll there, particularly in the southern part of the state. So then what made news and what made your piece fascinating was this data request that Blue Shield made. Talk a little bit about that and why that raised so many red flags.
Right. So one of the concerns with bringing in a health insurance company is, what data will they have access to? If you look at how data plays a role in insurance, it's a huge pivotal part of their business model, allows them to look at risk assessments. It allows them to expand into markets that they don't have a hold on. So there's a lot of different ways in which data could be a huge asset to a health insurance company. So with the partnership with California, Blue Shield was asked to create a contract that would go out to vaccine providers as a condition of receiving the vaccine so that the state can ensure that the data being collected is being done so in quickly. And so in this process, they created a contract that was sent out that we were able to obtain and ask some questions about, because it did require, as the University of California Health Systems called it, an expansive amount of data sharing that would have gone into Blue Shield's hands, according to the University of California. So there was a lot of concern there about how much data was going to be shared. Ultimately, that contract was revised, and the University of California was comfortable in signing it.
What kind of data was being sought that would have made the average consumer nervous about what exactly Blue Shield was getting its hands on?
Right. So the original contract did ask for medical records. The Blue Shield contends that they were asking actually for a record retention policy, that they weren't seeking the records. But it definitely in the contract, it left open that there was a lot of medical records that for a patient that could have been open to Blue Shield.
Gotcha. And when they revised the language, how did that kind of curtail what they were seeking, and did that kind of put the public a little more at ease? Have you seen this kind of scenario play out in other states? Is this something that's going on elsewhere outside of California?
Blue Shield, this is kind of a unique partnership with Blue Shield here in California in this rollout. So I haven't seen that kind of partnership with other states.
What's the moral of the story that as a country we can take from this in case there's a similar predicament in other states?
I mean, I think that oversight is just such a responsibility of us all, like to make sure that there is not the question of whether you have to give up your personal data in order to receive a life-saving drug. And so I think that there's a balance there that can be reached, and that there doesn't need to be this giving up of data in this realm. And I think that there are a lot of health privacy experts who would say, that you have to be careful about what you're giving up for medical data because there's no bringing that back. And so I think that with vaccine particularly, there's a rush to get it out the door. There's a lot of websites that will tell you that if you put all your personal information in here, we will find you a place to get vaccinated. And there needs to be a conversation about how we can do that safely without having to divulge too much of our own records. And just because once the cat's out of the bag, it's really hard to know what's going to happen with your own personal medical data.
Great reporting, as always, from the LA Times. Melody, thank you so much for giving us a few minutes of your time tonight and for the great work he did on behalf of all of the hopeful vaccinated in the state of California. We appreciate it.
Thank you.